And shifting our focus to the politics which has begun over the booster dose policy. Let's first play out the reactions that has in fact come in from the scientific community, from the medical fraternity. India will start giving booster shots to health and frontline workers and those above 60 from January 10th, and the vaccinations will also begin for children in the age group of 15 to 18 years from the 3rd of January. First, listen in to how the doctors have reacted to this.
I think this is a welcome step in the time when we are going to face the third wave, which is very imminent on our society. I think it is necessary for us to increase the immunity of the workforce, which is going to face the frontline attack of the COVID area. So definitely it will help in a long way to combat the COVID, which is going to penetrate into our country in a long way in the third wave. I'm so happy that the pediatric dose vaccination is also started. But a lot of studies such as proved very well that immunization is good for the pediatric age group also. The good thing is it can be also given along with the other vaccinations, it can be given, but the counter reaction will be less.
There is no need for parents to worry that a child who has a mild associated disease condition could be at risk for a bad outcome. As more data emerges, we will have a clearer picture. It is definitely a welcome move that vaccines are becoming available for children in India. As we know, vaccination of children has been carried out in many developed nations. And in India's perspective, even though our data show that children are at extremely low risk for severe outcomes.
Booster dose for the children, it will be very helpful because they will go to school, parents' worry will be over, and there will be less infection to others. That will help in the long run. Second thing about the health workers, they should be given because they need more protection because they are first line of treatment to the general public. They are to be safe, then others can be safe. That is very important. It's a long, our IMAs, it was long demand for this thing, which Prime Minister Modi has fulfilled.
I think all children can take this vaccine, whether they have a comorbidity or not, because in any case it's going to help all the children, and as our children will get vaccinated against this disease, very soon they will all take a life as normal as possible. Booster dose will definitely help, because you see, once the vaccine is given, and 2 doses as we have taken it earlier, so after a period of time, the efficacy goes down. So this booster dose is, as the name suggests, will boost up the effectivity and will help the body to maintain the antibody levels. So how it will definitely going to help the person to fight against the virus.
It's important since all the frontline workers and health workers included are up against this unachievable task of getting rid of this COVID infection. Along with this, our senior citizens who are above 60 with comorbidities like diabetes, hypertension, and liver diseases, renal diseases, they are more prone for infection. So I think it's an important step, as in Western world and Western countries where already they have achieved quite a 80%, 90% vaccination, they are giving booster dose. So I think it's a better to keep our children vaccinated, and most of the children are sitting at home and they are just, parents are worried if they send them home, send them to school, so they will get infected, and especially with this Omicron crisis which is looming around. The school did open, but most of the parents are reluctant in sending their children home. So I think it's a very important step, and very soon we will be having above 12 years of age also.
And just minutes after this announcement by Prime Minister Narendra Modi that booster dose will be administered to those above 60, and it will also be administered, vaccination will be administered to children between the age group of 15 to 18, the opposition rushed to take credit, with the likes of Rahul Gandhi and Owaisi claiming that the Prime Minister had accepted their suggestion. While some lined up to take credit, others questioned the government's policy, citing shortage of jabs.
Healthcare और फ्रंटलाइन वर्कर्स हैं, इस लड़ाई में देश को सुरक्षित रखने में उनका बहुत बड़ा योगदान है। सरकार ने निर्णय लिया है कि हेल्थ केयर और फ्रंटलाइन वर्कर्स को वैक्सीन की प्रिकॉशन डोज भी प्रारंभ की जाए। 15 साल से 18 साल की आयु के बीच के जो बच्चे हैं, अब उनके लिए देश में वैक्सीनेशन प्रारंभ होगा। 2022 में 3 जनवरी को सोमवार के दिन से इसकी शुरुआत की जाएगी।
ये मामला पुनः राहुल जी की दूरदर्शिता को पुनर्स्थापित करता है, प्रमाणित करता है। ट्वीट करके राहुल गांधी जी ने कई दिन पहले इस बात को देश के संज्ञान में लाया था, देश के नेतृत्व, वर्तमान नेतृत्व के संज्ञान में लाया था और विलंब हो रहा था। जो काम पहले ही हो जाना था, इस बीच में देखिए ओमिक्रॉन आ गया, ये सारी बातें आ गई। अगर हमने ये प्रक्रिया चालू कर दी होती तो कई लोग बच सकते थे।
You're watching the Newshour Special Edition Debate number 1 on Times Now, Super Prime Time.
All right, let's open this up. Let's go across to our guests. Tonight we're joined by Sanju Verma, National Spokesperson of the BJP. We have Karan Verma with us, author and political analyst. We also have Dr. Sushila Kataria, Director of Internal Medicine, Vedanta, and Kamruzzaman Chowdhury, leader of the Congress Party. We also have Dr. Sumansi Raman, political analyst on the broadcast. Good evening to all of you. I first want to go across to Mr. Chowdhury. Mr. Chowdhury, the allegation is that the opposition is now in this credit race. It wants to take credit because the government has announced that now booster dose will be administered. So, Mr. T.S. Singh, they were reminding the country and the government that it was Rahul Gandhi's far-sightedness.
Well, Swati, nothing to hide about this. When Rahul Gandhi ji first tweeted and he said the impending tsunami that is going to strike the country in the form of COVID. That time also the government was caught napping during the first wave, and we all know what happened during the second wave. And we all felt that the government was acting like Kumbhkaran. It was caught napping even this time also, when the Omicron scare is very real amongst us and it is creating havoc around the world. Now the point here that we need to put out to the public domain is that we need a vaccine-centric, people-centric policy, not a PR-centric policy. Of course, the Prime Minister has got every right to come on national television and announce the grandeur of the vaccine starts for the 15 and to 18 years old children. And
but how is the announcement category that the doses are going to be administered now a PR strategy or a PR campaign? And how is Mr. T.S. Singh, they're saying that it was Rahul Gandhi who first suggested, not a PR campaign? I just told you when the coronavirus was not even there in our country, Rahul Gandhi ji tweeted of impending tsunami. The government was caught napping at that time, and it is very clear in everybody's domain out here. Now, the basic point Swati, that now when the Omicron virus is really scary out here, the government goes to the Supreme Court and says by December 31st we will have finished 100% of the adult population. Now, what happened to that undertaking that they have given to the Supreme Court is not there. Now, when you so let's take a response from Sanju Verma on that. Over 60% of the people have been given both the doses, but your goal or the target that you had set was 100% adults would be inoculated by the end of the year. So we are falling behind. Why it's that? And the other thing, which Mr. Kamruzzaman Chowdhury is also claiming, that it was Rahul Gandhi who, even before corona pandemic hit the country, spoke about it.
You know, I listened to the Congress panelists very patiently, Swati. I'll quickly make a few points. I've tweeted about this quite, at length in the last 24 hours. But for the benefit of your audience, first and foremost, I think let's welcome the Modi government's decision to vaccinate children in the 15 to 18 age group starting 3rd of January 2022. I think the government has shown that it is receptive and it listens. This is a government that believes in working on the ground rather than Rahul Gandhi, whose only contribution during the COVID pandemic has been subah uthna, Modi sarkar ko galiyan dena, trolling the Modi government, and then go for vacation to Italy or Thailand or Myanmar, what have you. Point number 2, I think let's not forget that the entire population of India today is more than 4 times the population of America. We can add 4 United States, 1 United Kingdom, and perhaps fit in Israel as well. That is the size of India's population, equal to 196 small countries. And Swati, you'll be surprised to know it's in the public domain that on an average, India
that's not an
vaccinating.
excuse.
Chaudhary, please, let her finish. I don't want, this is a very sensitive issue. Please let her finish. Let's have an informative debate. Yeah.
Yes. On an average, India has been vaccinating every single day a population equal to 18 small countries. The average run rate has been 73 lakh people per day. That is the 15-day moving average. And 7-day moving average is even better. Now I'll just tell you quickly. We vaccinated accumulatively. The number of jabs given is more than 141 crore. The eligible adult population, without taking into account the 15 to 18 age group, because that announcement came in only yesterday, we've discussed this on your channel. We needed 198 crore doses to be administered because the eligible adult population is 94 crores. So I think 141 crore doses administered. We needed to administer about 198 or 188 crore doses. We are well within target, and I'm very confident that if not by the end of December 2021, by early,
I have to ask you a follow-up question as well. Once again, Mr. Chowdhury. Mr. Chowdhury, I have a follow-up question. Follow-up question is that there was a dip in the vaccination rate. It was sluggish. Now, you may say that we supplied vaccine, the opposition states did not administer, the opposition states saying that the government did not supply on time. I'm keeping that aside. There was a dip, but then, of course, the production was ramped up by the companies supplying the vaccine, and then we saw records being created multiple times. But my question is that the National Task Force, Sanju Verma, in August itself had asked the government to work on a booster dose policy. Why was that not done? And even when this target was set that we'll inoculate 100% of the adult population, we knew about the population of the country.
Okay. So, Swati, first, let's get this very clear. Right from the World Health Organization to influencers like Bill Gates, they've said that the manner, the rapidity with which the world's largest vaccination drive has been carried out smoothly, seamlessly and efficiently by Prime Minister Narendra Modi, thanks to his political will, despite vaccine hesitancy being propagated by the likes of Rahul Gandhi and Akhilesh Yadav, is commendable. So I don't think we need to be told by the opposition how to manage a global pandemic. India.
Okay, but then Sanju Verma, about the National Task Force, about having a booster dose policy in place.
Can I please finish?
Yes.
Like I said, today we have administered more than 141 crore doses. 61% of the eligible population has got both the jabs, and within the next 15 days, the entire eligible adult population will get both the jabs. We are not talking of 15 to 18 age group category because that will obviously start from the 3rd of January. My simple point is this, that when you talk about the Modi government, why is it that people forget that health is a state subject, disaster management is a state subject, transportation is a state subject, but nobody questions Congress.
Now you come to the state and the central subjects.
No, but Sanju Verma, I asked you a very specific question about the National Task Force asking the government to start working on the booster dose policy.
No. Can I?
Because the need may arise.
I can finish, then you can rebut me. More than 1.4 lakh COVID deaths have come from which state? From the state of Maharashtra, where Congress is in power. Highest vaccine wastage has been reported from which state? Rajasthan, where the Congress
Swati, if you don't let me rebut.
No. According to the data that was presented in the parliament, wasn't Uttar Pradesh also part of that list? Wasn't Madhya Pradesh also part of that list? Several states were part of that list, Sanju Verma. My question is very specific, and if you're not answering that question, I want to go across to Dr. Sushila Kataria. So, Dr. Sushila Kataria, of course, right now this is a welcome move that we are introducing the vaccines for the children as well. There is. I will come back to you. Other speakers are also there. I have to give them.
I'm giving you the data.
I have to. 1 second, Sanju Verma. I have to give them time as well. Listen to their arguments and then come back to you for a counter.
You refuse to ask questions to states.
I am not refusing to ask any question. I've been asking you one single question about the National Task Force, asking the government to start working on the booster dose policy. You aren't replying to that. You're not replying to that.
What do you want me to say? I have said this on your channel.
I am talking about the National Task Force.
Don't heckle me. Let me finish. The decision to give a booster dose, the Modi government said it.
I am not heckling anybody. You're the only speaker after Kamruzzaman Chowdhury who has spoken till now. I want to bring in Dr. Sushila Kataria as well. Dr. Sushila Kataria, right now, of course, this is a welcome move that the children are going to be given the vaccine. We are going to give booster dose to the health workers, to the frontline workers, to the adult population as well. My question is there a delay already?
There is no delay.
But the question is to Dr. Sushila Kataria.
There is no delay.
Okay.
The media will not decide when.
The question is to Dr. Kataria, please.
You are not going to decide. Media
It is a very good and timely welcome move.
Mute
which has
the
come
mic
up
for
right
her, yeah.
now. It is very easy to
allowing
say
anybody
whether
else to talk.
something has happened or not, but before going on to an additional or booster dose, some study and results and experience from other countries needs to take in account. And I think we are well on time to start this booster vaccination as well as pediatric vaccination. We know that there is a impending third wave or Omicron may strike India, but right now I think it's not too late, and it is not easy to take decisions like this because it has to be backed by the scientific data. It's just not that everybody is doing it, let's do it. So we have to have our indigenous data. We have to prove that booster helps. We have to prove that booster does not harm. And we have to prove that we have sufficient supply so that we can give it uniformly.
Right. Now, of course, media cannot take a decision on that. And the whole point of getting Dr. Kataria was to get a voice from the medical fraternity. I want to bring in Dr. Sumansi Raman. Now, Dr. Sumansi Raman, National Task Force says in August that you have to start working on a policy. And Tagi says we are in no hurry, that we don't need to rush into this right now because our priority is to first inoculate the adult population, make sure that people at least receive their first doses before we move on to the booster dose. And of course, the entire issue which is now being raised of the supply as well. Now, look at the contradictions. Mr. P. Chidambaram says millions of doses are lying unused. You need to inoculate people using those as booster doses. Mr. Sitaram Yechuri says, where are the vaccines?
Okay. First of all, we know that it is the pressure which has come from various quarters. I'm not saying only from Rahul Gandhi. Very clear. It is crystal clear. A week ago, or about 10 days ago, the NTAGI tells Serum Institute, look, your data is based on... Tell that lady to keep quiet. Tell her to keep quiet. I did not interrupt her.
Sanju Verma, please, let him finish. Let him finish his point.
Mute her mic.
No, let him finish his point, please.
Let me finish.
Sanju Verma, let him finish his point.
Rahul Gandhi's contribution.
Let him finish his point, Sanju Verma, please.
She can't allow, because that's the problem. Look, the point is very clear.
Sanju Verma, let Mr. Sumansi Raman finish his point.
You are not a doctor, you are a quack.
Let him finish his point.
Okay, now, I don't want to get into who are all circulating certificates for which there is little evidence of degrees and so on. That won't be a very pleasant discussion. But I do have I have multiple degrees which I'm happy to put out for authentication should anybody so require it. Now, the point I'm coming to is very simple. That the NTAGI told Serum Institute that we cannot give you approval for a booster. Please go back and do a local study. And when did they say this? 10 days ago. So Serum Institute, which actually applied for a booster for Covishield, was told less than 2 weeks ago, please go back, please do a study in India and submit the data. Now, clearly, something has happened between the time that the NTAGI said this, because otherwise, had they known that the Prime Minister was going to announce the booster commencing from January 10th, clearly the NTAGI would have approved it based on the UK data. So, it is crystal clear. And let's be honest, it is not pressure from Rahul Gandhi alone that is made. That is a ridiculous charge, ridiculous attempt to claim credit. But it is pressure from multiple sources, including the members of the medical community. Large number of doctors had come out vocally on social media to say that boosters are needed and they are needed as like yesterday, right? So please, if anybody is trying to kid us and say that this has nothing to do with the pressure exerted from various quarters, that has forced the hand.
Ultimately what counts is
to make my point.
Ultimately, what counts is what the scientific community, what the medical fraternity has to say. This is something that the health minister also said in the parliament, that we are waiting for our scientific community to give us a go-ahead, to give us a nod.
Why has it been announced?
How do these political voices, whether it is of Rahul Gandhi or anyone else, matters when you are waiting for the medical fraternity to give you a green signal? Karan Verma wants to come in. Where is the data? Asks. Okay. Your question is, where is the data?
Swati,
given a green signal.
Okay, let's bring in Karan Verma, and then I'll open up the debate on where is the data.
Swati, can I make my point, please? Right. Swati, as per a report by the local circles, which is the most comprehensive report, the number one reason why we are facing resistance right now is vaccine hesitancy. There are 11.5 crore Indians as we speak today who are hesitant to take the shot. Now, where has this vaccine hesitancy come from? A major role has been played by the opposition. The continuous flip-flops. Let me take you back, jog your memory a little. April 9th, Rahul Gandhi writes a letter to the center saying that the state should be allowed, the program should be decentralized and the state should be allowed. 1 month later, he makes a flip-flop. You ran a package just before the start of the show where you showed the Chhattisgarh health minister. He is the same minister who expressed apprehensions about Covaxin and later on took the shot himself 2 months later. This kind of fear-mongering, this kind of, rhetoric which has been so irresponsible, whether it is from the Samajwadi Party which said BJP ki vaccine, whether it is Arvind Kejriwal who said states should be allowed to procure vaccine and then made a U-turn and blamed the center.
Right.
I think this has contributed largely to the biggest cause of vaccine resistance, which is vaccine hesitancy. 11.5 crore.
Swati.
Now, if we continue with politics over vaccine, this vaccine hesitancy is going to become our biggest roadblock. There are 200 million doses right now available, and that was voiced by Aadhar Poonawalla as well, that there are not that much of a supply bottleneck now as much as vaccine hesitancy has come in. And this is largely exacerbated by politics, which needs to be plugged in. Rahul Gandhi is a unique case. He says everything. One day he'll say the center should make vaccine available for another. Other day he says
Kamruzzaman Chowdhury,
so that he can
the opposition and several prominent leaders in the opposition contributed to vaccine hesitancy, and today you want to take credit.
May I please?
No, ये जो करण वर्मा जी बोल रहे हैं ना, इसको बोलते हैं हिंदी में चोर कोतवाल को डांटे।
कैसे? क्या ऑपोजिशन के नेताओं ने नहीं कहा था कि ये बीजेपी की वैक्सीन है? गौरव पांडी said that this has serum of a newborn calf.
Let me finish it. Please have that much of courtesy. Thank you. Now, there are two major important points. The Modi government has changed the vaccine policy. This is the fifth time that they have changed the vaccine policy. Number 2 point. When we have developed the indigenously the Covaxin,
that should be changed, sir. We should be flexible in this approach.
No, wait, Karanji, let me finish my point, please. Let the people judge whether I'm speaking right or wrong. You are not the judge in this panel. Thank you. Now the point is that when the vaccines are being developed, the central government refused to give compulsory licensing to other manufacturers of the country. We had faced a huge vaccine shortage out there. The Covaxin was not approved by the WHO.
This is very interesting. You're calling it an indigenous vaccine now, Mr. Kamruzzaman Chowdhury. And that's why the question, when it comes to contributing to vaccine hesitancy, because it was called the BJP ki vaccine.
Swati.
Now, this is exactly what has contributed.
It was called the BJP ki vaccine.
I am a science student. No, Swati, you have invited me. I am a science student. I believe solely on scientific data. Now, the main question here is, when will the 48 crore adult population who are yet to get the vaccination get those 60 crore vaccination? Karan Verma says there are 20
now let's take that data from
available. Where are the 40
let's take that data from Sanju Verma.
And
when will you meet the target? Where is that vaccine going to come from?
18 years get the vaccine.
Okay, take response from Sanju Verma.
8 crore adult population are yet to get the 60 crore vaccination.
Take a response. Take a response. Yes. Sanju Verma.
You know,
We cannot ramp up supply till there is not demand.
You know, can you please not stop this background music? Because you don't allow me to heckle anybody. I don't want to be heckled and I'm making
I'm asking you for your counter.
Yes, so I'm giving you my counter.
Go ahead then.
I heard you say.
Go ahead then.
Yes.
Okay. Can you unmute yourself, Sanju Verma? You're not audible. Can you unmute yourself?
मौन व्रत में हमारा पैनलिस्ट साहिबा है.
Sanju Verma, you're not audible. Can you please unmute yourself? I can't hear you.
Not a bad thing in itself.
Yeah, Sriman.
Okay, there seems to be some issue. Some issue. I am not able to hear. One second, please, gentlemen, please. I think she has been disconnected. Let's connect her once again. Meanwhile, I want to bring in Dr. Kataria. Dr. Kataria, now the big question is: will this impact the ongoing vaccine drive? Because the booster shots are going to be administered to the healthcare workers, to the frontline workers, to individuals who are 60 and above.
I don't think that it is going to affect the already ongoing process, because now the vaccination program is a very well-oiled and well-run program, and adding few more doses is not a supply is not a problem. We already have a very effective pediatric vaccination, so taking care of the teenage vaccination is also not difficult. And as we see, the number of people who are coming for vaccination at our centers also is reducing day by. So I think it is very well equipped to handle an extra burden of extra dose or booster dose or caution dose, whatever you want to call it. I don't think operations would be a challenge here.
Okay, operation is not going to be a challenge for all those who are asking, where are the vaccines? How are we going to cover the rest of the adult population? Kamruzzaman Chowdhury, you had concerns regarding that. A doctor on the panel says it is not going to affect the ongoing drive. Okay, Mr. Suman Siraman, then Mr. Verma.
I'd like to ask the doctor a few questions. What are the vaccines that are going to be used? What is going to be is the government going to allow mixing and matching of vaccines like is being done in different parts of the world, where people who got AstraZeneca are now given Pfizer as the booster? Third, she said that the data has already, they were waiting for the data, and now the indigenous study data is what the government was waiting for. So if she can, put out a few links where we can go and see that data, that will also be helpful.
Okay, Dr. Kataria.
So I can speak in my own capacity. I do not have the detailed what government is going to do, but in my own capacity, what I can say is that yes, we should allow mix and match of vaccines that can boost the immunity in more holistic way. And in other countries also, we have found that mixing and matching is actually superior to using a single type of vaccine that we have found. Then on the data, I think the Serum Institute recently said that their third dose was proving to be more effective. And similarly...
But that was rejected by the government. That was rejected by the NTAGI, who said, please, this is only 75 patients and they are from UK. So please go back and do a local study and come back. Which is what was the biggest surprise, which shows that...
Okay, as far as the government stand is concerned, Mr. Suman Siraman, I think Sanju Verma is back with us on the broadcast and she can maybe answer those questions. Yes, Sanju Verma.
Okay. Swati, I just want to say one thing, that any vaccination program, the success depends on accessibility, affordability. The Modi government has made vaccines affordable, in fact free for those who cannot afford it. My simple question is that it is the duty of the state governments to ensure when vaccines are available, why is it that vaccination centers are not spacing out the vaccine administration program so that large numbers can be vaccinated?
The government procures the vaccines and sends it to the states. It's not the state government that are procuring the vaccines as of now.
Doses are lying unutilized. Why is Maharashtra not utilizing the unutilized dosages? Why is Rajasthan not utilizing the unutilized dosages? Why is Chhattisgarh not utilizing the unutilized dosages? And as for Rahul Gandhi, I say Rahul Gandhi is the Mungeri Lal.
And why are you so afraid of Rahul Gandhi?
How absurd is that?
Ask your Prime Minister.
Because Mr. Kamruzzaman Chowdhury, in fact, T.S. Singh, they was the one who brought in Rahul Gandhi into all of it. The opposition is saying we said so to the government.
No, Rahul Gandhi was still... No, Swati, Rahul Gandhi was always
there. You can
start from the warning the country, warning the government that this needs to be taken seriously. But what we saw was...
Okay, Mr. Kamruzzaman Chowdhury, earlier you wanted to ask Sanju Verma some questions about meeting the target. Let's seek a response on that. Yes, Sanju Verma, go ahead.
Swati, can I come in?
After Sanju Verma.
Swati, I just want to say, we'll not discuss about the fact that Rahul Gandhi is the Mungeri of Indian politics. Mungeri डाल के हसीन सपने देखिए and become a credit जीवी. सारी देश की जनता जानती है you did zero work during COVID. I want to ask one thing, Swati. You rightly pointed out that opposition said ये तो BJP.
Point out the facts, man. आंदोलन जीवी और ये सब
अरे सुनिए ना कमरुज़्ज़मान चौधरी, अब सुनिए डिबेट मुद्दे पर होने दीजिए प्लीज. कमरुज़्ज़मान चौधरी,
the country is asking questions.
This is not fair.
Please cooperate with your co-panelists. You've asked a question, let her answer.
The moment I answer, and you're not even knowing, the moment I speak with guys coming in, can you ask him to shut up, please?
No, I won't ask him to shut up, but please have some patience, Mr. Chowdhury. Please let us finish.
I want to take you back, Swati, to April 2021. There were 3 tweets by 3 senior Congress leaders. Manish Chaudhary, he said, when the Modi government gave approval to Covaxin, the Modi government is treating Indian citizens like guinea pigs. The same
Who is Manish Chaudhary?
After a day by Shashi Tharoor, who said, Manish Tiwari, pardon me. The same thing was repeated by Shashi Tharoor, who said, Modi government is treating Indian citizens like guinea pigs. Why has it given approval to Covaxin? After a few days, Jairam Ramesh...
One simple question I asked, when will the 48 crore adult citizens get the 60 crore vaccines? That is the only question I asked.
Why are you propagating in the opposition?
When will we meet the target is a question that is continuously being asked, Sanju Verma.
You have... When will the opposition...
31st December is just 4 days away. Till 60 crore vaccination are in shortfall.
During the first wave, apart from getting up every morning, sipping a cup of coffee and trolling the Modi government. Tell me one thing. Rahul Gandhi...
No, he doesn't take coffee, ma'am. He doesn't take coffee. No, he doesn't take coffee, ma'am.
Of India's active caseload. What has Rahul Gandhi done for Wayanad? What has Sonia Gandhi done for
Swati, can I please come in?
Okay, other speakers also want to come in now.
I must make a point.
Okay, so Mansira.
Mr. Kamruzzaman is asking for a very unreasonable, argument. He is asking for facts. How can he ask for facts? And that too from Sanju Verma, he wants facts. I mean, that is, I would really, I express criticism of Mr. Zaman for asking for facts. How can he ask for facts? He can ask for trolling, for abuse, for personal attacks, but not for facts.
For everybody, the Modi government has taken a decision based on scientific evidence. We are not going to...
No, the question was, what is the new deadline? The question was, what is the new deadline? When are we going to provide covers to the entire adult population? That was the question about a deadline. We're going round and round on that particular question. So let me ask a question to Dr. Kataria. Dr. Kataria, many people who were given both the doses were also found to be infected with the Omicron variant. Now that we're talking about the booster dose to be given to 60 plus, what is the kind of protective cover that we are looking at? As it is, so far it has been reported that the Omicron variant does not show any severe symptoms.
Because of large number of mutations, the immune escape phenomena was expected in this kind of variant, and it has happened. We have seen that people who are fully vaccinated are still getting infected, and this was also during the Delta wave, but it was not so pronounced. Also, there is increase in reinfection, which in a recent study has come out to be around 9%, which was earlier around 3%. So this immune escape phenomena is expected. We may probably will not have a foolproof, mechanism or protection, but I think a combination of mask properly, social social distancing, COVID appropriate behavior, along with a booster or an extra dose of vaccine. This is what the maximum which can be provided. So I think though we strive for 100% protection, but I think any increased protection is a good protection, and it is going to help at least in decreasing the hospitalization and overwhelming the healthcare system as it happened in the last time.
Absolutely. And I think the other big concern would be to make sure that the administration of the first and the second dose to the rest of the population that has been left as far as the adult population is concerned goes unhindered. Meanwhile, there is no hesitancy when it comes to inoculating the children. You know, those are the big concerns that we need to focus on. We would also need some awareness campaigns, some awareness drives to be conducted by the government to iron out whatever hurdles come in the way. Thank you very much, Sumansi Raman, Sanju Verma, Dr. Kataria, Mr. Karan Verma and Kamruzzaman Chowdhury for joining us in the broadcast.